Real life, please. Dr. Vedika.
Okay. Um, a very good afternoon to all the participants. So this is Dr. Vedika Mhatre and I will be the moderator of today's webinar on surgical approach to management of eyelid affection in pet animals with Dr. S.D. Tripathi sir. So I'm currently pursuing my master's degree in veterinary surgery and radiology and working at BSPC Animal Hospital. So we are having Dr. S.D. Tripathi as our speaker for today's webinar. He is a renowned veterinary expert and associate professor of Department of Veterinary Surgery and Radiology in Mumbai Veterinary College and has completed PhD. Also, he is affiliated with the Bombay Veterinary College Alumni Association, Indian Society of Veterinary Surgery, Indian Veterinary Association, Indian Society for Advancement of Canine Practice, Pet Practitioners Association of Mumbai, Veterinary Practitioners Welfare Association. So he was a co-PI in establishing a minimally invasive center, CPC SEA approved animal house and an ophthalmology unit at Mumbai Veterinary College. He was a coordinator for 36 training programs and ICR Winter School and an external examiner for UG, PG and PhD exams across multiple universities. Also, he has organized 6 national dog shows as secretary, served as coordinator, co-coordinator for various training programs. He has received award for the Indian Indo-Asian Best Teacher Award in 2021, ISVS 2020 Best Oral Presentation, received gold medals in ISVS 2018 and 2019. Also, he has received Young Scientist Award in 2019 and multiple appreciation awards. Dr. Tripathi has published 70 research articles in journals of national and international reputation and 20 popular articles. He also has got appreciation from Marksu for outstanding contribution during the LSC campaign and certificates from various dignitaries. He also got first prize in cattle judging in 2000 and essay in 1990. So I welcome Dr. Tripathi for being speaker of this webinar. Also, the panelists, we are having Dr. Shalaka ma'am, Shalaka Chavan. She is who is assistant professor in Department of Surgery and Radiology in KNP College of Veterinary Science, Shirwal, Pune. She has done PhD in VSR and has published 57 research papers, 9 book chapters. She is also a hospital registrar and in charge in placement cells, assistant in charge in academic cell, technical officer to registrar. She is also co-PI in veterinary research projects, done project in surgical and wound healing studies in 2022-24. Also, she got award for Association Fellow ISS 2023. Has received award for Indo-Asian Best Teacher Award in 2021. Received gold medals in small animal surgery in 2018-19 and Professor S.J. Angelo National Young Scientist Award in 2020 and Best Paper and Poster Presentation Awards in 2020 and 21. I welcome Dr. Shalaka ma'am. On the panelists, we are having Dr. S.V. Gaikwad, who is also a PhD surgeon and associate professor in Department of Surgery and Radiology in Mumbai Veterinary College. Also has affiliation with Bombay Veterinary College Alumni Association, ISVS, Indian Society for Advancement of Canine Practice, Pet Practitioners Association of Mumbai, Veterinary Practitioners Welfare Association. He is a co-PI in establishing the minimally invasive center at Coas Parbhani, led the establishment of the thoracic surgery unit at Mumbai Veterinary College. He was a coordinator for 21-day winter school in collaboration with ICAR, served as an external examiner for UG, PG, and PhD examination across various universities. Also has organized 6 national level dog show as organizing secretary. He has coordinated 36 training programs. Dr. Shahid has awarded for best oral presentation at ISVS 2022, secured third prize for oral presentation in wildlife surgery at WildCon 2020. He has received gold medal in small animal surgery ISVS 2018 for research on laparoscopic assisted herniorrhaphy in dogs. She is recognized by MAPSU for outstanding contribution during the LSD campaign and received multiple appreciation certificates from dignitaries. He has served as internship coordinator at Mumbai Veterinary College. I welcome Dr. Shahid Gaikwad, sir. So now I request Dr. Tripathi sir to continue and start the webinar. Dr. Tripathi sir, you can continue your PPT.
Yes. So, can everyone see the screen? Is the presentation seen?
Yes, sir. Yes, sir.
Yeah. So, thank you very much, Dr. Vedika Matre, for your wonderful introduction. And I'm very happy to have Dr. Shalaka Chauhan and Dr. Shahid Gaikwad as panelists for this webinar today. I welcome all the participants to this webinar on surgical approach to management of eyelid affections in pet animals. Before I proceed ahead with my presentation, I must thank Entod for considering me as a suitable candidate for presenting this seminar. And also my university authorities, Honorable Vice Chancellor, Director of Research, Director of Instructions, Dr. Upadhyay sir, Director of Extension, my Associate Dean sir, and also my department HOD, Dr. G.S. Khandekar sir, who has been my mentor and guide for a lot of things. So without their cooperation and support and encouragement, there are a lot of things that I may not have been able to do. But because of their support, there has been many things that I've been able to do in my life. Okay. And I'm here as a representative of MAFSU and Mumbai Veterinary College. And I would like to just show a few things that our university and college is doing with regards to ophthalmology is concerned. So we had started work right from the inception of our surgery department in 1967, and we have done work on corneal injuries, cataract, even corneal transplantation. Our own Dr. Shri Supadhyay sir, he has worked on corneal transplantation in bovines during his PG research work in the year 1992 at Mumbai Veterinary College. Besides that, other veterinary colleges are also doing wonderful work with regards to veterinary ophthalmology is concerned. As you can see, there has been research work done in cataract surgeries, corneal ulcerations, and management of corneoconjunctival growths in Udgir College, in Parbani, and also in Shirwal. A lot of work has been done with regards to corneal injuries and their repair. Same has been the situation in Akola Veterinary College also. So now when I looked up to the presentations that have already been done in association with webinar, many of renowned ophthalmologists are there in this particular group, and they have already presented on a lot of important topics. So there have been presentations with regards to cataract diagnosis and repair, diagnosis of corneal eye affections, and many other dry eye conditions have been considered. One area that was not considered till now was the eyelid affections, and many a times eyelid affections can lead to various severe injuries to the eye and may be a cause of a lot of issues. So I thought it would be a fit option to work and talk or deliver lecture on this particular topic. Again, it is a matter of great pride and privilege to be in an association with some of the stalwarts who are member of the All India Veterinary Ophthalmologist Group. Many of them, many of the stalwarts like Dr. Shamvi Samnis, Dr. Komal Raul, then Dr. Kasturi and other people have been a part of Mumbai Veterinary College, and with their sheer dent of hard work and their passion for ophthalmology, and especially solving the ophthalmological problems in pet animals and of our country, they have made a name for themselves. So it is a matter of pride for me to be in association with them, and also to share and interact with them, and thereby increase my knowledge also, as well as, enhance the field of veterinary ophthalmology. So here today I am there with all of you to talk about the approaches, surgical approaches to manage eyelid affections in pet animals. Now, what is happening when I'm talking also, you might have seen there may have been blinking so many times. We blink so many times in a day, but we are hardly concerned as to whether, we are not very conscious when we are blinking about. It goes on without our knowledge. But it is very apt. Somewhere I read that, many a times things which are taken for granted, like blinking of the eye, the eyelids, they are taken for granted. Even many times the owners may complain, or as a clinicians, we may, owner may complain that there is, watering from the eyes, there is some squinting present, but many a times we may just, disregard that complaint. But if this eyelid issue is not solved, many a times it can lead to various serious problems. So there has been a saying that सत सैया के दोहरे ज्यो नावक के तीर देखन में छोटन लगे घाव करे गंभीर. So something can be very, very small issue, but if it is not looked into at the right time and in the right way, it can be a major source of problem for an individual in his or her life. And same in the situation for pet animals. If this issue of eyelid problems or eyelid diseases are not considered at the right time, they can lead to severe problems. And during the course of this presentation, I shall try to dwell on a few of them. Many of the issues, or many of the photographs are our own photographs that we do at our institute. Some of the conditions are rare, and so I have taken the help of standard textbooks like Slater, Fossum, and Gillette to give an idea with regards to the conditions that are there. And also some photographs I have also sourced from the net. But many of the pictures and everything is from our own institutional work that we do here in Mumbai Veterinary College. Okay, and again, without spending too much time on anything else, let me show you the ophthalmology unit of our college. You can see we have a full-fledged, well-established ophthalmology unit having the operating microscope. This is the Galaxy Pro operating microscope and the FICO unit. And we have got ophthalmological surgical set also, direct and indirect ophthalmoscope. And we are performing cataract surgeries, extraocular surgeries quite regularly. And a lot of work has been done in our department. Again, it is, the kind of advancement that has been made in clinical practice with regards to eye affections in the field is really tremendous. And our institute is also in hand with the progress that is being made in field conditions. Again, this particular ophthalmology unit, actually the new machine which is there, earlier we used to operate with the help of Z's operating microscope, which was donated to us by Dr. Swaranjit Singh Bhatti sir. He is a great ophthalmologist, human ophthalmologist, and fortunately we have been in touch with him for quite a long period of time, and I must take his name for the help and support that he has given us to establish this unit. Now just have a look at this eye. You can see these three beautiful pictures. And the first picture you can very well identify is that of a golden retriever. Very, very nice view with regards to the way the dog is looking up to you. Anyone looking into these eyes will melt definitely. Again, see the beautiful eyes of this cat. How beautiful, shining, glistening the eye appears. You can very well make out the margins of the eye. You can see the cilia, the hair. You can very well see the palpebral facial and the lateral and the medial canthus, both with regards to the dog as well as in the cat. Now, you must, there are a few things that we should know. So in case of cat as well as dog, it is the upper eyelid which is much more mobile than the lower eyelid. Again, the lower eyelid in both the cats and dogs does not have any eyelashes or anything present, but in case of the upper eyelid, the eyelashes or cilia are present above the margins of the eyelid. Okay, and majority of the blood supply as well as the nerve supply to the eye is from the especially to the eyelids is from the palpebral branch of the facial nerve. Now, if you see the third picture, you can very clearly see, you can make out that this particular picture is not of a healthy cat. You can see the excess growth of hair. You can see markings present at the medial canthus. You will see that there is narrowing of the palpebral fissure. So just on the look on the picture, you can very well make that, yes, this is not a healthy photograph of a healthy, not a healthy photograph. The animal is not a pet is not being kept in a proper fashion. Again, I must stress one particular point here. Many a times the affections of the eye are related with the care and management that the owner is giving. Many problems can crop up simply because of the fact that the ears have not been cleaned for a long time, and there is severe ear mite infestation, there is severe wax deposition, or there is severe pus formation in the ear, and yet the owner has not taken a care to look into the ear of the dog or the cat. And when the animal starts flapping his ears, rubbing his ears, scratching his ears, and in the process, maybe sometimes he can even injure the eyelids, the cornea, and the other structures. But a very important feature that we can find out is that the side of the ear which is affected, and the animal, if it scratches quite a lot in that particular area, you'll find there will be allopathic patches noted in that particular area. So that also is many a times an indication on clinical examination that yes, the ear also might be affected when we are seeing or when we are examining the pet. So with the discussion that we had, we can understand how important the eyelids are for the health of the eye. And if they are not taken proper care of, they can lead to numerous conditions which can lead to surgical affections. But the gracing point here is that the eyelids have got abundant blood supply, and this helps in healings of any wound or incision present in the eyelid. Again, this is a saving grace for surgeons because it can help or make our job very easy also, and sometimes it can make it difficult also. Most of the abnormalities of the eyelids, they are concerned with the conformation of the lid structure as well as the globe structure. Sometimes in certain species of animals like the pugs, you will find that the eyelids are not able to close properly. They are not able to cover the whole eye, called a condition as logophthalmos. There may also be a situation when there will be eversion of the eyelids. Now, these cause excessive exposure of the eyeball. So whenever there is an excessive exposure of the eyeball, the eyeball is, or the cornea is more prone to develop ulcerations, infections, tears, all these conditions. Again, entropion, there could be inward turning of the eyelids, and this again can be leading to a lot of eye affections. Let us have a look of this particular, have a small look at this video as to how we can examine the eyelids. This is the same cat which was shown in the earlier slide, and you just have a look at the eye. See the severe trauma that has happened to this particular eye, and look in this eye, the right one also. See, the eye is being kept closed by the cat. You can see there is some amount, though the eyeball shape is normal, still some amount of irritation or swelling and discharge is noted at the lid margins also. Some amount of swelling is present even in the left eye. Now see the globular structure, pink color structure that you can see. So this case was brought to us at a very late stage. In the left eye, you can see the eyeball has reduced in size. There is severe, severe tissue or eventration of the structures of the eyeball, anterior chamber structures into the outside environment, and again there was very little we could do in this particular case. Again, this thing, why I'm emphasizing is that because by the time the pet comes to us, it is very late many times for us to to actually solve the problem. In such a situation, it's very important for us to keep the client also aware, and as a teacher or a academician, for us also to make sure that we keep on reiterating the importance of clinical examination in pet animals. A lot of times as clinicians, it is very, very important for us to make sure that we make a habit of clinically examining each and every part of the animal when it is brought to us for any complaint. It may have been brought to us for loose motions, or it may have been brought to us for any other condition, but it is very important that we examine right from the tip of the muzzle to the tail end. And only when we develop this habit, we will be able to identify a lot of problems, treat a lot of problems before they become very, very major issues. So very important for all the people who are there live in this presentation to humbly listen to this particular area of clinical examination, and especially show for the eye. Now, when I look at the patient in front, what I should be able to see is that I will be able to see the eyelid margins, and you will find that these eyelids, they are covering just the limbal surface of the cornea. And you will find that you can see the cilia present above the upper eyelid. You will see tarsal gland openings present on the lid margins if you are able to evert the lid margin. And if you are very clear in your observation, you will also be able to see the lacrimal caruncle and the openings of the lacrimal duct in the upper and the lower eyelid as well. Now the eyelid, though it is a thin structure, it is richly supplied with blood vessels, it is richly supplied with nerves, muscle attachment is there. You have the orbicularis oculi muscle, which is responsible for closing the eye. Then there is the levator palpebra muscle, which is responsible for opening up the eye. Mueller's muscle, again, it is responsible for opening up of the eye. You have your meibomian glands, which are responsible for secreting the mucin layer, which is again required for moistening the cornea. You have your the gland of G's, and then the cilia arising out from the lining of the lid, just above the lining of the lid as such. Okay, so the nerve supply to these muscles is again from the palpebral branch of the facial nerve, as I told you earlier, and the blood supply is from the branches of the maxillary arteries. This is the blood supply and the nerve supply source for the eyelids, upper and lower eyelids both. Okay, now in this particular picture, you can very clearly identify the lid margins. We can very clearly see the glistening lid margins in both the lower and the upper eyelid. And if I have to point it out to you, I can show you the opening of the lacrimal duct. So you will find this depression that you are seeing here. This depression, that is an opening of the lacrimal duct into the from where, all the tears get collected and they will enter into the lacrimal duct as such. Okay, so this is the lacrimal puncta, the opening that is present in the upper and the lower eyelids. Again, you will find the location of this puncta is hardly say 2 to 3 millimeter away from the medial canthus. Okay, and in the medial canthus, this caruncle is seen. So our idea of where the medial canthus is, where the lacrimal caruncle and the lacrimal puncta is, where is the lateral canthus, what is the type of lining of the eyelids, this is very, very important for us. Because if we are clear in this particular issue, if we are clear in this particular anatomy, then any abnormality can be very well easily identified by us just on clinical examination. Just on basic clinical examination, a lot of our problems can be identified. Let me show you a small video of the lacrimal puncta opening and the duct here. So this is just yeah. So this is the opening of the dorsal lacrimal puncta, and here you will find this is the opening of the ventral lacrimal puncta, and you can make use of 24 or 25 gauge ID cannula also in order to locate it. Why I'm stressing on this? Because many of the procedures, surgical procedures that can be performed may involve the lacrimal puncta or the lacrimal duct if they are not done properly. But if we are clear with the anatomy, a lot of procedures, simple procedures we can perform at our clinical setup, and we can prevent further damage to the cornea or to the eye. So most of the things I have already spoken about in the earlier slides regarding the the anatomy and the function. Again, one thing we should remember, or we are going to discuss here, is the third eyelid or the nictitating membrane, which is nothing but a T-shaped hyaline cartilage. Again, it is important for it covers the eyelid eyeball whenever there is movement of the eyelids, and also it secretes the aqueous layer of the tear film. Again, this tear film is what keeps the eyeball moist, the cornea moist, and it is responsible for the glistening appearance of the cornea. So if there is any abnormality or any procedure which interferes with the secretions of the eyelids, then it can ultimately interfere with the health of the cornea. That is the importance of the eyelids today. So any inward turning, any outward turning, any abnormal positioning of the eyelids can lead to interference with these kind of secretions, or covering of the tear film to the cornea, and again cause major problems. So let me now get into the details of the eyelid diseases. So eyelid diseases can basically be classified into development or congenital abnormalities, and they can also be classified into acquired disorders. So in development or congenital abnormalities, basically we have the ankyloblepharon, eyelid agenesis, dermoid, blepharophimosis, uriblepharon, then entropion, ectropion, distichiasis, and ectopixelia. Now entropion, ectropion, a lot of times, a lot of animals, they could be a development or a congenital abnormality, but many a times they could also be a result of an acquired condition. If suppose there is a tear, or if suppose there is a laceration, so the wound healing and the cicatrization itself can lead to entropion or ectropion like conditions. Okay, so entropion, ectropion can be development as well as acquired. But eyelid tumors, chalazion, hordeolum, these chalazion and the hordeolum, these are the infectious conditions. We will see each of these conditions. And again, lid laceration, they are traumatic injuries, acquired conditions. They could be because cat fighting with one another, or a cat or a dog fighting with one another, or so many reasons can be there for it. Okay, and these lid lacerations ultimately can again lead to entropion and ectropion. So each of these conditions we shall try to discuss and see how we can solve the problems to the best of our capability. Now, whenever you have eyelid issues or corneal issues or any issues, majority of the symptoms, are more or less similar. So even if there is a problem with the cornea, again, there may be, reflex which can further complicate the problem of cornea. So whether the problem is basically because of eyelid issue or a corneal issue, still many a times, it can be very, very confusing. It could be like something whether the egg came first or the hen came first. But, if we pay attention to a few things, we should be able to classify whether it is an, development abnormality or whether it is a problem related with the cornea or any other structure of the eye. So you will find there will be epiphora, excessive lacrimation will be there. So you will find your medial canthus will be stained with tears in a lot of cases. There may be blepharospasm, closing of the eyelids will be there. There could be pawing, rubbing, squinting. There could be serous or mucopurulent discharge from both the eyes or the affected eyes. As I told, there could be alopecia also present. Eyelid discoloration may be there, conjunctivitis, and even corneal ulcerations may be present. So if we do a small examination of the eye, many a times nowadays, what is happening is that more and more people are keeping brachycephalic dogs or small breed dogs or toy breeds. So we have abundance of pugs, we have got abundance of Shih Tzus, we have got abundance of Lhasa Apsos, we have got abundance of Persian cats. Nowadays their population has increased, and many of these animals are very, very hyper. They are not very amenable to clinical examination. In such a situation, especially for cats, they can be really a pain to examine if they brought to the clinics. In such a situation, having a bag like the bag that I've shown in the picture, these are cat restraining bags. Even if we have these kind of things, they can make our examination of the eye very, very easy. We can examine each of these structures properly. We can instill lignocaine or propcaine eye drops, and again we will find if it is related with the corneal issues, the reflex spasm, the pain that is caused because of the corneal trauma, that will be lost and the animal will open its eye normally. But suppose if it is because of the abnormal position or abnormal development of the eyelids, then you will find even after protrusion or installation of the eye drop or lignocaine or propcaine eye drops, you will find still the spasm may be present in a lot of cases. So this simple test and examination can help us a lot of times what the situation is, or whether we really need to go to treat the eyelids or whether we need to treat the cornea per se. So first abnormality that we see is the congenital abnormality, and that is called as ankyloblepharon, which is nothing but a union of the upper and lower eyelids. Now what happens in a lot of cats and dogs, it is well known that the eyelids will open in after by 14th, 15th, or say 20 days. A lot of people say that. However, as per literature, if the eyeball or if the eyelids are not opening beyond 14 days of age, then they have to be considered as a ankyloblepharon. Okay, and what you will see in this particular picture, you can see a very clear-cut depression present between the upper and the lower eyelids. So this is an indication that there is a attachment between these two eyelids, and most of the times this is because of a infection, a staphylococcal infection or any other infection. So we may have to pass a blunt tenotomy scissor in between the eyeball and the eyelid, and very carefully get rid of this attachment and make sure that the eyeball is properly cleaned in with the aseptic solution, so that the infection is drained off as much as possible. And again, post surgery, you can go ahead with your antibiotic drops and carboxymethyl drops, so that the eyeball continues to remain moist and further complications are not noted. Next in the line of congenital abnormalities will be the eyelid agenesis. Now this is a very, very rare condition, and many a times literature mentions that it will be seen most likely in cats. Now as you can see in the picture, you will find this 2/3 portion. Now the lateral 2/3 portion of the upper eyelid is absent. Now, most of the times it is the upper eyelid which is affected with this particular condition. What is the reason for it? There has been no conclusive evidence for it, but many of the research findings say that the problem basically happens because of the defect in the migration of the neural crest. This kind of defects will cause this eyelid agenesis. Okay, now here the photographs that I have taken is from the textbook, because in all these years, whether it is fortunate or unfortunate, but we have not actually come across any such condition. As you can see in the text also, it is a rare condition. So I will be taking help of the pictures to help you understand how this particular problem can be solved, and again help myself also understand how this particular problem can be solved. Okay, so the treatment option that has been given has been described by Zaik and Millikamp. They have described the procedure, and this basically involves the transposition of a skin flap. So from the lower eyelid, you will find a flap will be taken up, and that flap will be rotated onto the upper eyelid. Okay, this is where it will create it. But before you create this, you will have to get rid of a part of the tissue. You will have to separate this particular conjunctiva from the upper skin, and again a mucous membrane layer, or the palpebral conjunctiva layer will be taken in certain conditions from the third eyelid, and then it will be sutured to the portion here, and thereafter the skin will be sutured onto this conjunctival layer so as to form a proper conjunctival fornix. So that's why 4 steps are involved in this particular procedure. There will be creation of the recipient side. So this is the recipient side, which will be first the structure here will be clipped, and then separation of the skin with the conjunctiva, lower conjunctiva will be done. Then the donor site is created from the lower eyelid. Okay, and this lower eyelid creation is rotated 180 degrees, as I showed earlier, to be put on the upper eyelid. And again, there has to be this eyelid rotation also, your palpebral conjunctiva rotation also, for preparing the proper bed for the upper eyelid. Okay, and thereafter the donor sites are closed. So let us see this with the help of pictures. Okay, so here you can see the upper eyelid tissue has been removed, the separation of the skin and the conjunctiva has been done, and then you will find that at the same time the donor bed has been created. A small notch is created at the lateral canthus so that the flap can be rotated onto the upper eyelid. Okay, and this picture shows the flap that has been taken, palpebral conjunctiva that has been taken up from the third eyelid. Okay, and that is how you will end up getting the appearance of the eye after the completion of the procedure. Next is the dermoid or dermolipoma. Again, this is an abnormal development of lid skin. This is a congenital defect, and you will find that the area of dermis is located on any region of the eye. It could be located on the sclera, it could be located on the cornea, it could be located at the lateral canthus of the upper or lower eyelids. Okay, now if it is on the cornea or on the sclera as such, it is if it is a large defect, then again you should not be ashamed of referring these kind of cases to expert ophthalmologist for doing this particular procedure. However, if the edge is very small or something, you can remove it yourself. Okay, as you can see here, again, this particular procedure will have to be done under general anesthesia. You can't do it just like that. You have to anesthetize the patient. What we use here is the sedation with either buterphenol or buprenorphine or midazolam, diazepam. Then we give induction with propofol. And again, these are short-term procedures, so just maintenance of propofol itself may be useful many a times, or you can also use gaseous anesthesia if it getting prolonged. So this is the tissue, as you can see here. This is the tissue. Okay, and you can see the abnormal hair pieces arising out here from the eyelid tip. So what we did a wedge resection here, got rid of this particular growth, and now after complete healing, the dog appeared normal. Now this problem was proceeding for the dog for the last 2-3 years, and the owners were really disturbed with regards to the presence of this particular tuft, and this was something which can very easily be done at a normal clinical setup as well. Okay, then we have a condition called as blepharophimosis. or blepharospasmostenosis. As you can see in this particular picture, this is the picture of a Chinese Sharpie. You will see the palpebral fissure. You cannot see the opening of the upper and lower eyelids. So this is what is meant by your blepharophimosis or blepharostenosis. In certain breeds, it could be, a desired trait, but a lot of times, if this particular appearance of the eye is causing, or the location of the eyelids or the structure of the eyelids, if it is causing problems with the cornea health or corneal irritation, then in such a situation, lateral augmentation canthoplasty will have to be performed. What it is, we will see in the next few slides of our presentation. Okay. So this is what lateral canthoplasty is. You take a normal tenotomy suture and take an incision at the lateral canthus of the eyeball and of the eye, and thereafter you suture the conjunctiva to the eyelid structure, so that no further attachments will be happening. This can be done with 6-0 non-bulb observable suture, but again, even if you have 4-0, 5-0 sutures or 3-0 sutures also can be used successfully for repair of this particular condition. Then we come across uriblepharon or macroblepharon or macropalpebral fissure. Again, as the name suggests, now here earlier you have got that the palpebral fissure is very small. Now here you will find the palpebral fissure is very large. Normally, in case of certain breeds like Saint Bernards, Shetlands and other breeds of dogs, this could be a normal desirable trait. And they have a typical appearance of the eye called as the diamond shaped appearance of the eye. So you will find that the eye is raised, eyelid is raised in the center, and again it is drooping down from the medial and the lateral canthuses. A lot of times you don't have to worry about it, but again, if it causes irritation to the cornea, then you may have to perform the permanent lateral tarsorrhaphy or a medial canthorrhaphy. Again, now any case with this kind of problem has not come much, but right now we have a case like this in the ward with having a corneal opacity, bilateral corneal opacity, and maybe this must have been going on for a long time, so we plan to this particular procedure in that particular dog. But right now what I will be showing you is the permanent lateral canthorrhaphy, wherein the eyelid piece, as you can see here, the part of the eyelid is removed. Okay, and you will find it is removed along with the other structures also. The part of the your orbicularis oculi muscle also may be included in this particular structure. Okay, and then those will also have the tarsal glands in them, and thereafter you will find the conjunctiva is sutured, and thereafter 8 shaped bites are taken for closing the palpebral fissure. So excess or exposure of the eyelids can be closed by means of lateral canthal tarsorrhaphy. One condition which we come across very commonly, but many times which can be missed also, but is the reason for loss of the eyeball structure itself, is the entropion. Again, it could be a congenital abnormality or it could be a acquired abnormality, both. As I had shown in the earlier pictures, this is the normal eyelid which is there, and lower eyelid you will find it is bent inwards. So because it is bent inwards, what is happening is that these eye cilia or the eyelashes or the cilia which are present close to the margins of the lower eyelid, they are actually rubbing onto the cornea, so continuously they will be keeping on rubbing the cornea, and they can lead to severe ulcerations and damage to the eyeball. So just remember the first picture, first video I showed you, the eye was damaged to such an extent that we had to ultimately extirpate it out. Okay, now it could be development spastic entropion, again because of foreign bodies, because of chronic conjunctivitis, again because of inflammation of the conjunctiva, cornea. There could be infection of the uveal structures. these could be the main reason for entropion many a times. Again, there is a shrinking of the eyeball. Again, this shrinking eyeball may cause the eyelids to move close to the eyeball, again causing injury. You can see in the picture, this is a picture of a congenital entropion. As you can see, a lot of excess skin is present. This is seen on the chow chow also, in the sharpeye also, and this is an example of cicatrical acquired entropion that we got in case of a Labrador. Okay, now very easily this can be identified. There will be epiphora, rubbing. So if any dog like a chow chow or a Chinese Sherpa is brought to you with history of epiphora, rubbing of the eyes, blepharopasm, or cat having continuous brachycephalic conformation with conjunctivitis or corneal ulceration, so you can use proparacaine to give local anesthesia to the cornea and examine the position of the eyelids, and thereby take a call what is to be done, whether the eyelids have to be corrected or it is the corneal issue. Again, if even after instilling the proparacaine or lignocaine drops, you find that the spasm is not relieved, most of the times it would be related to the eyelid position. Okay. So medical management also have been described for it. There has been reports that if you inject a large dose of penicillin into the eyelids or into the conjunctiva, it will separate the eyelid away from the cornea and thereby reduce the inflammation or the injury. You can also use topical antibiotics till that time while you are using or making help taking help of the proparacaine injection. Again, Elizabethan collar also should be used in any eye condition. I mean, this is a routine for me that if any case comes to me with a history that there has been some powing or discharge from the eyes, lacrimation or squinting, I always tell the owners that the first thing you do is please make sure that you apply the Elizabethan collar so that further injuries are avoided. However, in most of the cases, medical management fails and you have to go in for a surgical correction of the eyelid. Okay. Now, you can place the position in ventral or lateral recumbency. We do the procedure in lateral recumbency in most of the cases, and there are various surgical techniques that have been described. So you can go in for eyelid taking, but again, it is useful only up to in animals up to 20 weeks of age. And you can also go in for excisional procedures. This is basically useful in animals which have a severe or a chronic condition. So you can go do a coronal frontal or coronofrontal or stellate rhidectomy. Now, rhidectomy. Now, this is a procedure which many a times is used in case of Sharpeis, in case of Chow Chows. Lot of cases like this have come to us and we have performed this procedure successfully. Brow suspension can be done. Again, you can make use of mesh or sutures, but the reports with regards to their success is not very good. Then the most common technique in normal animals besides your Sharpeis or Chow Chows is the Celsus technique. Then you can use the hot Celsus technique, where you can use it with cryoablation or electrocautery if there is ectopic cilia or any other condition, or you can use hot Celsus technique with eyelid wedge resection in case there is a lateral eyelid entropion. Now, entropion can happen in the mid portion of the eyelid. It can happen in the medial, towards the medial canthus. It can happen towards the lateral canthus. It can happen in the lower eyelid. It can happen in the upper eyelid. It can involve both the upper and lower eyelids and the whole of the upper and lower eyelids. These are the various presentations in which your entropion can be noted when you clinically examine it. And then you can also go in for wide to view correction. Especially it is useful in case of cicatrical or cicatrical entropion. We shall see some of these conditions one by one. Now, when you are doing these kind of procedures, these are the things, these are the instruments and equipments that you should have. You can have entropion clamps, you can have Jaeger eyelid plates, your needle, pars needle holder, again, 40, 50 or 30 observable vicryl or, is also very useful in these kind of procedures. Again, tenotomy seizures can be made use of to make the, cuts or the incisions onto the skin surface. Okay, now this is an eyelid tacking procedure that has been showed. So this is vertical sutures are taken. So you pass the needle from one end, okay, and then you again pass the needle from one end, and thereafter you tie it. And so you'll find these two folds of skin. Now these two folds of skin will make sure that the eyelid margin, it is moved away from the cornea, as you can see in this particular picture. This is in case of a cat. This was a cat which was presented to us with the entropion of the lateral canthus. And so we did a tacking here first to see whether it is, this tacking itself helps it, because if we don't do it, further injuries can happen. So this is the tacking that we have done, and we will see how it responds to this particular procedure. Okay, then the Celsius technique, again a very simple technique. What you do here is that you make use of mosquito forceps to, first you find out what is the amount of tissue that has to be removed, and then you clamp it with the mosquito forceps, and you do it from both the sides, or depending upon the length of the tissue that you want to remove, and you keep it in position for say 30 seconds or so. After 30 seconds you will remove the clamp. So what you have a proper strip of skin that you can remove with your tenotomy scissors. And once you have done that, you can take silk sutures to close this particular wound. Again, you will see the particular picture. There was a entropion in the mid portion, and here what has happened, that you are able to close it by simple interrupted suture, and this is the corrected eyelid. Okay, so Celsius technique, very easy, very simple technique that we can make use of in a lot of conditions. Now, what other technique is the hot Celsius technique? Here, what you do, you make use of a Jaeger plate, and then you take an elliptical incision as per the assessment that you have done for improving the condition. And here the first suture bite is taken in the center of the incision that you have done, and then on both the sides the bites will be taken so as to correct the abnormality that you are seeing. Okay, so this is the bite. Okay, now many a times, in dogs like pugs, in Pekingese, you will find nasal skill foods are present. And these nasal skill foods, they are many times everting towards the eyeball, and they can cause injuries. But the owners are, reluctant many times in order to remove it. So a partial resection of this particular skin fold can be done, again, to prevent any injury to the eyeball. Even complete resection of this particular skill foods can be done. Again, this has to be done, all these procedures. It will be my humble presentation that any eye conditions should be done under sedation and anesthesia. If not deep anesthesia, at least light anesthesia should be used in order to make sure that you are performing these particular procedures. Next is, if there is a lateral canthal entropion, then you do a arrowhead resection. As you can see in this particular, like an arrowhead, you have made the incision, and this incision is cut with the help of tenotomy forceps, and the ocular muscle and the conjunctiva will be sutured, and thereafter, like you did the Hall Celsius procedure, first the central bite is taken, and thereafter, bites on both the sides will be taken so as to correct the entropion that is present. Now, we will be seeing some cases, conditions that we see regularly in our wards, and this could be, we have seen it in Labradors, we have seen it in Rottweilers, we have seen it in Persian cats, we have seen it in our domestic short-hair cats as well. Okay, so you can very clearly see here, there is lacrimation, mucopurulent discharge present here. You will find that the eyelids appear to be a little edematous or swollen. As you can see here, see both the eyelids, upper eyelid as well as the lower eyelid, it appears to be swollen. So when you see these kind of structures, many times this is an indication that it is related with the eye position itself. Okay, now let me just show you the video. So this was a very small video. Okay, we could very easily identify, examine it. Now this we are doing it before the surgery, but even in normal patient also, you can very clearly open the eyelids and see whether the eyelid margins, they are properly covering the eyeball as such or no, or whether they are inverting inside or everting inside. Now in this particular case, we had performed the hot cells technique for all the four eyelids, and it gave us wonderful results. When this particular cat was brought to us, it has a lot of issues with regards to corneal ulcerations and pigmentations and even vascularization. But after this particular procedure, the cat responded really well. So this would have been really great if I could play this video. I don't see why it is not playing now. Yeah, yes. Just see how you can examine it. You will find the whole of the eyelid, upper and lower eyelids are involved. You can very clearly see the ulceration and the whitish discoloration of the cornea. Okay. Same is the case in this particular eye also. You can very clearly see. Now see the eye, turning inside, and you will find the ulceration is present on the upper quadrant of the eyelid. Okay. And now once we have done the procedure, this is the cat after successful correction. It is very playful, very happy, and taking food from the owner. These are some of the markings that you are seeing, post-operative markings of the sutures that have been taken. So now okay, so the cat responded quite well to this particular surgery. Now, this is a case of Rottweiler, as I told you. So what we are doing here is we are making use of the tissue forceps to mark the amount of tissue. So we hold it part of the skin with the tissue forceps and then see to what extent this entropion is getting corrected. And that particular tissue, that particular area, it is removed or incised with the scalpel blade, and then it is cut and removed. Whatever bleeding or anything is there, with the help of mopping or digital pressure, we try to reduce. It's not much. Most of the times it is just say 3 millimeter away from the eyelid margin. Okay. This is the sutured. You can see the very sutured line, and this is the post-operative appearance. In the initial few days, it may appear as if it is overcorrection, but then once the inflammation or the swelling goes down, you will find the dog or the cat is perfectly normal. Now, we discussed about radiodectomy. Now, this was a very satisfying case for us. This case, had been there to a lot of places, and here the owner was reluctant not to pay a lot of money. So he had come to our hospital because he wanted this thing to be done, in a cost-effective manner. So in our hospital, we perform this particular procedure, and you can see the amount of excess, skin that is there. Let me just point it out. Yeah, this dog was very fractious, not allowing anyone to touch, even biting the dog owner. We had to anesthetize it to examine it properly, and you can see excessive, prolapse of the gland of the third eyelid. You can see the entropion of the upper and the lower eyelid, and you can see the whole skin, dropping onto the eye as such. And this problem was there for a long time. The cornea itself was severely affected with excessive neovascularization, ulceration, opacity present. So we had to perform the radiodectomy here. Coronal radiodectomy is what we performed. See the skin folds that are covering the eyelids and the eyeball. Okay, this is the excessive. You can see the discoloration of the cornea. You can see the discoloration of the prolapsed gland. Both right and left eyes were affected in this particular case. Okay, So we performed the entropion surgery first for the upper and the lower eyelids, and thereafter we pulled up the skin portion. Now the here aim little variation we had done was we wanted to remove as much of skin as possible, because there have been reports that if the surgery is not done to the extent that we need to remove the tissue, again recurrence can happen. So we pulled up the skin to the maximal possible extent, and then we took the incision with the help of electrocautery. This is the excessive skin that you see that has been removed. This is after the removal of the skin. Now our aim was that this particular neck skin should push or pull the skin that is rolling onto the surface of the face. Okay, so this is after the sutures. You will find a little bit of involvement of the ear also, both the ears also. And thereafter, this is the dog at this point of time. Okay, see the happy dog. Now you can not identify that is the same dog. You can see the eyelid, the eyeball very clear, both the eyeballs very clear, and it is enjoying its life now. Okay, so this honor was this dog has been have been living a happy life since the last year and a half or so after the coronal radidectomy that we have performed. Okay, now post-operative care in a lot of cases of whether it is a radidectomy or whether the entropion surgery, cell cyst technique, or the hot cyst technique, or the lateral conthoplasty that you have done, you have to make sure that you apply the Eyelid collar, you use the analgesics, topical antibiotics, okay, and madriatics if there are any corneal ulcer separations present. Some complications like undercorrection, overcorrection, or there may be damage to the lacrimal puncta, especially if you are trying to correct the medial entropion, or there may be injury to the orbicularis muscle, which may lead to hemorrhages, post-operative swellings. The facial appearance may alter sometimes, but it may alter for the good in a lot of cases. Okay, and if the dog is fractious like the chow chow that I just described, then woundations also is a very real possibility. Of course, we are lucky that we did not come across woundations in that particular case. Okay, prognosis in a lot of case is good. However, how much, to what extent the eyelid contour will be normal, it's very difficult to say, but if it is done in a proper way, we will get wonderful results out of it. The next condition we see is the eyelid entropion condition, wherein there is outward rotation of the eyeball. Again, you will find this particular condition is normal in certain breeds like Saint Bernards. But again, if it remains for a long period of time and it starts causing problems, then you need to take corrective steps. Okay, so this is the eyelid, which is a margin which is everting out. Again, it could be a development, or it could also because of acquired conditions, injuries, or sometimes the orbicularis oculi muscle may be fatigued. As a result, the closing of the eyelid will not be in a proper fashion. Most of the times, if a dog is coming to you and it belongs to Saint Bernard or a Basset Hound or a Great Dane, you should suspect that this particular problem is there. You will very clearly see the outward rolling of the eyelid. Conjunctiva will be exposed. There will be excessive epiphora, conjunctivitis, sometimes dry eye condition, injury, infection to the cornea, and again, because of the epiphora, dermatitis around the eyes also will be noted. So how do you do it? If there are any corneal ulcers or conjunctivitis present, you have to make sure that you treat it by making use of topical antibiotics and carboxymethyl cellulase drops. Okay, and surgical management, you can do it in ventral recumbency also or in lateral recumbency also. These information should basically be useful for PG, PhD, or UG students who are, if at all they have joined it, because what particular technique to be used, I am describing a little bit detail. So wedge resection we can make use for in case of mild to severe cases of ectropion. Then conjunctival resection with or without wedge resection. Now basically this helps in improving the cosmetic results. V2Y correction, this is very useful in case of cicatricial ectropion condition, and this is the most easy procedure that you can perform in a clinical setting again. Then there is the modified Kunt-Zymona ski procedure. Okay, this reduces the risk of scarring of the lid margins Also, it prevents damaging the cilia or the mammalian glands. Okay. And if there is a combination of entropion and ectropion both in the same animal, you can make use of this particular condition to solve the problems at the same time. Again, you can also make use of lateral blepharoplasty. Again, this is useful if there is a combined entropion and ectropion procedure. Okay. So Wharton-Jones blepharoplasty or a VY plasty, what you say here, you take first assess to what extent the tissue is to be removed. The length of the incision should be a little longer than the everted eyelid margin. Okay. And you remove the flap of skin and you start with the lower end of the incision. So if you start closing from the lower end, you will find that you can close it very well in a V-shaped fashion, and this will cause the inversion of the eyelid towards the eyeball again. Okay. And this is a very simple procedure which can be performed in a lot of clinical settings. Now, if you do a lateral blepharoplasty, this can help in combined entropion and ectropion conditions. Okay. Here what you do, a piece of the skin and the is removed along with the separation of the orbicularis oculi muscle, and thereafter simple interpreted sutures are taken to cover the orbicularis oculi muscle and the incision that you have taken. Again, this will help in correcting the entropion and ectropion at the same time. Okay. Then wedge resection, you remove a V-shaped portion of the of the eyelid, and thereafter you suture it by 8-shaped suture pattern. Okay. And this is the final appearance. Again, this is a simple technique, easy technique that can be used for correction of ectropion. Again, for ectropion also, post-operative, you have to make use of e-collar, you have to use analgesic, topical antibiotics, and all the complications that can happen, undercorrection, overcorrection, wound dehiscence, damage to the lacrimal ducta is possible in this particular case also. However, if you perform it in a proper fashion, there should not be an issue. Prognosis, again, a lot of times good, but you know, the contour may not be as it was or as it should be naturally a lot of times. Next condition we see is called as trichiasis. It is nothing but extra eyelashes, presence of extra eyelashes. Most of the times it will be noted in breeds like Shih Tzus, Cocker Spaniels, and other species. In this particular picture, you can see this is the extra row of eyelashes that is there, and many times they are soft eyelashes, and if they are soft and they are not clumping together, then there may not be many injuries noted. But if they are firm and they are directed towards the cornea, then severe injuries can happen. So you can make use of slit lamp biomicroscope to examine this particular condition. While all the other conditions that I mentioned earlier, just your clinical examination, physical examination can help you diagnose. But here, slit lamp biomicroscope may actually help you in identifying the presence of the excess cilia onto the eyelid. So you treat it either by manual epilation. Again, this is a temporary procedure. However, what this temporary procedure does is that it gives you time to treat the corneal ulcer that might have happened. Electroepilation is again what you can make use of electric current. Wire is passed down the root of the hair and then it can be removed. But again, chances of burns or tissue injury is there. So this particular method has been now abundant, and now the cryoepilation procedure or use of nitrous oxide is now very increasingly being made use of in field conditions by expert veterinarians for removing this particular problem. Again, tarsal plate resection, you split the eyelid wherein the tarsal along with the cilia will be removed. Again, not very good reports are present with regards to its efficacy in literature, but cryoepilation is what is being recommended at this particular point of time. Okay, then you have your trichiasis. Again, this is an abnormal angulation or position of the eyelids. They may be normal cilia also, but if it is directed towards the cornea, it can cause problems. If the cilia is not very firm, it is soft, does not clump together, then it may not be a problem. But again, in certain breeds like pugs, in Shih Tzus, if you examine the medial canthus, some hair tufts are present in the medial canthus, and because of the lacrimation, these tufts of hair, they can really become like pointed needles, and a lot of injuries can happen because of these tufts of hair. So what a simple procedure can be done is that you can always advise the owners to give a simple massage to this medial canthus of the eye. Now what this does is that if there is any blockage of the puncta, it will relieve it, and the normal discharge from the puncta of the tears will happen, and this problem will be avoided. Lot of cases we come across where they have developed severe trauma, glaucoma, and all those things, and then there is no other option but to remove the eyeball. But if this simple exercise is done, I can say with confidence that a lot of problems can be avoided. So you can see this particular picture. These are some of the dogs that have been brought to us with this prolapsed gland of the third eyelid, or called as the cherry eye, or also the third eyelid prolapse. Okay. So this is basically noted. We have found it in Cocker Spaniels, we have found it in Beagles, we have found it in Lhasas, we have found it in Pugs. These are the dogs which have come to us with this particular condition. Again, we find it happening in young animals, especially in case of Beagles and Cocker Spaniels. We find it is noted in, say, 3-month, 4-month-old or 2-month-old puppies. But we have found it in Lhasas and other breeds. Adult animals also have shown. Now, many a times, because of the lack of the attachment of the ligament of the gland to the third eyelid cartilage, this kind of prolapse can happen. Many times inflammation or infection can lead to this kind of prolapse. So earlier people used to just clip it off, but this gland is very much involved in secretion of aqueous layer of the tears. So if you remove it, there is a 20 to 30% shortage of the tear film, and in the long run it can lead to dry eye condition and other problems. So repositioning it is the best technique that is being recommended at this point of time. Most of the times topical treatment is unsuccessful, so surgical treatment only will have to be done. Okay, now in surgical management, the main aim is to make sure that the protrusive gland behind the lid margin is replaced back, the mobility of the nictitating membrane is maintained, and also the glandular structure and the function of the gland is taken care of. So the concept of surgical removal has now taken a backseat. Of course, in certain conditions, it may have to be done, but in a lot of cases, anchoring techniques or replacement techniques is the technique of choice basically for this. And the replacement technique that we use is called as the pocket technique, also called as the Morgan eye pocket technique. This diagrammatic representation very beautifully brings out how this particular procedure is to be performed. So on the an incision is taken, elliptical incision is taken around the prolapsed gland, and then your 304050 absorbable suture vicryl can be taken to take simple continuous bites and replace the gland in its position. If you take a cross section of it, this is how the gland reposition itself. Now let me just show you what we have done in the case that was brought to us. Okay, so same incision has been taken around. You can very clearly see this is the incision line that is seen around the gland, and from the anterior and then towards the posterior surface, that is towards the cornea side, your bites are taken, making sure that injury to the cornea or any other structure is avoided. And then the gland is pushed back. See here. Yes. This is how it will be pushed back. Okay. Minor variations have been described by so many authors for this particular technique, but this is what we have done it, and we find this is very, very effective. So this picture shows the, post-operative appearance of the procedure, surgical procedure. Okay. Again, post-operative Elizabethan collar antibiotics, most of the times it is good in acute and mild cases. However, recurrence is possible. But if I have to report the number of recurrent cases that I've got in the last so many years, we have been performing this procedure, and the recurrence rate, I can't remember that there has been a recurrence or not. I don't think so. Then eyelid masses, they can be inflammatory, they can be neoplastic, they can be, benign neoplastic growths like histiocytomas, papillomas, or they can be malignant types like growths, which could be like squamous cell carcinoma, adenocarcinoma, or hemangiosarcoma, or fibrosarcoma. These are some pictures. As you can see, this is a squamous cell carcinoma, which is seen in case of the lower eyelid, medial towards the medial canthus of the cat. This is in case of a dog, Shih Tzu here, with having this nodular eyelid structure. Okay. Now, this many a times you will have to combine with chemotherapy, radiation therapy, cryotherapy, laser therapy, hypothermia. So many techniques are there. But again, best technique is surgery. Our teachers have always told us in surgery, cut it, shut it, forget it. So if you know what you are cutting, how you are cutting, and how you have to close it, there is hardly much reason that you have to worry about, especially in eyelid masses, because majority of them are benign masses. Okay. Now, certain things that you should always keep in mind is that whenever you are excising an eyelid mass, you have to take an elliptical or a circular incision. Closure of the eyelid margin or the incision has to be done 90 degrees perpendicular if it is on the lower eyelid, and parallel if it is on the upper eyelid, to avoid any other complications like entropion, ectropion, or things like that. Again, Z-plasty, transpositional, pedicle, or advanced, flaps can be made use of to close it. Full thickness excisions of masses will have to be done if they are involving the lid margins as well. If they are anywhere else, okay, but if it is on the lid margin, then it has to be, full thickness excision of the mass. Okay. Now, if the mass is involving more than 1/3 of the length of the eyelid, then it has to be closed by a single pedicle advancement flap or by a lip to lid flap. We will see with the help of pictures how this can be done. Okay. Again, if you are not an expert in this, like you have to, make sure that it is taken care of by proper expert ophthalmologists rather than you trying these kind of procedures on your own. Okay. So here we make use of the Chalazian clamp to localize the mass. We have taken a house-shaped incision. Now, if it is less than 1/3, this house-shaped incision itself is effective. But if it is more than 1/3, then you will have to take an elliptical incision to goes to the lateral margin also. Okay. Now, this what it does, it will help in pulling that skin mass towards the eyelid margin and thereby closing it. Okay, so this is the final appearance of the incision that you have taken in case the eyelid mass is more than 1/3. Okay, then the H-plasty technique also is a very useful technique that can be performed. Okay, here what you will see, you take incision. Now you have removed and block this particular mass. So what you do, you increase the incision, you separate the skin away and bring this particular skin close to the eyelid margin. Okay, and then suture it up. So this is the final appearance that you will have. Okay, this is the final appearance of the eyelid once you have performed this particular procedure. Okay, in severe cases, lip to lid construction has to be done, wherein 2 parallel incisions are taken close to, on the gums, and then separation of that particular skin and the mucous membrane is done so as to prepare the eyelid flap, and thereafter is sutured. Now, I have taken help of some pictures from the net in order to help you understand this particular condition. So as you can see, you mark the area that is needed to be incised. The incision is done as per the marking that you have done. And this is how the flaps have been created. Once these flaps have been created, you suture it up, and this is the final appearance of your lip to lid resection. Okay. Again, post-operative care, have to apply topical antibiotics, analgesics, Elizabethan collar. Depending upon the type of tumor, you may have to use the other techniques that I have told you. Other very common condition we get because of fight between dogs or cats is eyelid laceration. So this is an 8-type pattern which you can make use of to close that gap that has been formed. So this was a dog which was brought to us because of dog fight. It has a tear in the eyelid and form this 8-type of pattern of suture, and the post-operative appearance you can very clearly see it has healed quite well. Okay, then there are inflammatory lesions that I talked about. So hordeolum is nothing but an infection of the eyelid lace follicle. So if it is involving the gland of Zeiss, it will be called as external hordeolum, and if it is involving the tarsal gland, it will be called as internal hordeolum. Again, you incise the lesion either with the scalpel tip or the 24 gauge hypodermic needle and remove the infection. Chalazion or tarsal cyst, it is called as. Here the Mebanian gland, it gets blocked, and because of it, it swells up. So sometimes the painless, firm mass may be noted on the eyelid. Again, you have to incise the gland and remove the material. Okay. Now, final thing what I would like to say is that most of the eyelid affections, they can be very confusing to identify. But as I told you in the presentation, if you make use of lignocaine drops or proparacaine drops, many times it can help you identify the condition very well. And the best technique is your proper clinical ocular examination. So many times no hi-fi things are needed, but if you're doing a proper clinical examination itself, you will be able to identify majority of the problems. If there is any history of epiphora or squinting, make sure that you call the owner to the clinic or to the clinics, and then make sure you examine it and identify whether there is actually a problem or not. Don't let it on the owner. Just a lot of people will prescribe tobramycin de do, ye de do, wo de do, and by the time the cat comes to us or the dog comes to us, the eyeball is completely gone. So please don't do that. Examine the eye, see what best can be done. Some techniques we have already discussed, and we can use that technique in clinical setting and help prevent these kind of problems. Okay. Now, early surgical treatment, if you give it, a lot of possible complications such as removal of the eyeball will be prevented. Okay. And some techniques are very simple to use. Make sure that you use it in your clinical setting. Okay. Thank you very much for your patience, and I hope I might have added to your knowledge and information. And if there is anything that you'd like to help me know further, you are free to ask questions and discuss. Thank you very much. Thank you, Entod. Thank you, everyone, for your presence, cooperation, and support.
Thank you so much, Dr. Tripathi sir, for giving this wonderful presentation. Now I request participants, if they are having any queries, doubts, feel free to ask.
So are there any questions? How many people were
Yes,
there?
we are having. Yes, sir, we are having some questions. So, Dr. Tripathi sir, what are the most common eyelid conditions
You're
in
not
pet that
audible.
require?
Dr. Vedika, you are not audible.
Okay. Am I audible, sir?
No, not yet. I mean, yeah, it's very low.
Is it clear, sir?
Yes, yes.
Okay. Okay. So what are the most common eyelid conditions in pet that requires surgery?
What?
What are the most common eyelid conditions in pets that require surgery?
See, entropion is one common thing that will need it to be, surgically operated upon. Then with regards to the third eyelid, it is the prolapse of the gland of the third eyelid that needs to be operated upon. Again, entropion, as I told you, it is available in various forms. It can be lateral canthus, medial canthus. It could be the whole eyelid being involved, upper and lower eyelids involved. So accordingly, most of the conditions that I come across is the entropion. Very, very common. Then we come across eyelid lacerations. Then we come across small, dermoids, which are there. Again, as I said, certain conditions like eyelid agenesis and other things, they are not very common, but there have been reported in literature.
Oh, thank you, sir. Dr. Shalaka, ma'am, we are having a question for you. So, what are the potential complications after surgery, and what post-operative care is needed?
Most of the potential complications, they depend on how you plan the surgery and how the care has been taken throughout the post-operative period. And the innate behavior of the eyelid structure is when the wound is healing, it cicatrizes. Cicatrizes means it shrinks in nature. So that can cause the complications like entropion. So there can be inward turning in complication also. So that also you have to manage. And then with those you can have corneal ulcerations, and then it's a pagoda kind of a event which one thing leads to another in development of serious nature issues like corneal ulcer and then further perforation or desmetocele or perforation, so on and so forth. So that could be the complication where the eyelid surgery can go wrong. Or if you cut too much of the portion of the skin, that may lead to ectropion also, that is excess eversion of the eyelid. So that will lead to loss of precorneal tear film or things like that, leading to dry eye, and then further conditions which has been explained by Tripathi sir. So that can be, which can be managed again surgically.
Okay, thank you so much, ma'am. So, Dr. Shahid sir, will you please guide us which anesthesia will be safe for the page for the eyelid surgery? Also, please enlighten about the recovery time of anesthesia.
Yeah, because most of the eyelid surgical procedures, they are very short duration surgical procedures. So most of these procedures can be performed under the deep sedation with midazolam and betrophenol like things and with local infiltration. But the surgical procedures which requires more time and the more complex type of surgical procedures, in that cases, we'll have to give the general anesthesia, and that to a short acting general anesthesia like propofol, or you can keep the patient or induce the patient and maintain the patient on the inhalation anesthesia. But before giving the any kind of sedation or anesthesia, the veterinary or we will have to assess the we have to evaluate that patient clinically. The health assessment of the patient is very important for the good type of anesthesia and uneventful any recovery.
Thank you so much, sir. Dr. Tripathi sir, so how much does eyelid surgery approximately cost for the parents?
Well, at our institute, so it is very cost effective. So it would be wrong on my part to really say this is the cost, because as I told you, the case of coronal radidectomy that we performed somewhere outside, it was being quoted as 160 or something like that. And here, it was as good as free, because the hospital charges and everything is not very much. Okay, so what do I say? It's very difficult to say how much it costs. It depends upon the skill of the surgeon. It depends upon the expertise and the facilities available at the setup. We are fully full-fledged unit we have, but again we are a government institute, so here it is very very cost effective. Minor surgeries, it is costing 3,000. Major surgeries, sorry, surgeries, it is costing now 3,000, and minor it is costing 2,000 here. And again, medicines and everything the owner has to get, but it is very very cost effective, at least in our institute. And all of us are very much well versed with these particular procedures, and many of our postgraduate and PhD scholars are also performing these procedures on a regular basis. So it is not much of a problem if you bring it in Mumbai Veterinary College. But private, I can't really say how much it can cost. It can cost anything.
Oh, thank you, sir. So, Sulaka ma'am, what is the success rate of eyelid surgeries, and if whether the pet's vision is affected after surgery or not?
I'm sorry, what is the second part? Whether what is affected?
Pet's vision is
Pet's
affected.
vision.
Yeah.
Yes. Yes, the success of eyelid surgery, I would say, is very good, or you can even have a success rate of 100% also, I will say. If, like sir said, if you know where to cut, when to cut, and how much to cut, and how to suture. So if that is definitely a skill, but if you've harbored that skill, the success rate is very high. And there is very little that can go wrong here if you follow the certain principles and if you understand the proper anatomy, which was again covered in detail by sir in this seminar. So success rate is very high. And the second part of this, I would like to answer that what could go wrong. I already mentioned in my earlier answer that if you are not planning the surgery properly, whether it is ectropion, whether it is entropion, or whether it is macroblepharon, or whether you are dealing with any growth. So if you are so for growth there will be recurrence, so that is something you will have to again uh, rely on other modalities or other type of treatment options in case of tumors, that is cryosurgery and chemo and many other things which sir covered. And those with in which you have to correct the eyelid defect. So for correction of eyelid defects, you need to measure the distance, how much you have, how much is excess, and that much you have to remove. Whether you want to do it in terms of V2Y plasty, whether you want to do it in terms of canthoplasty or arrowhead lap technique, which is called as. So accordingly, you can uh, do it and reduce the way of complications, or there's very little. And in case of cherry eye, there is chances of recurrence. We if it is brought pretty late. But if it is brought for surgical correction very early, then the success rate is very high. So I think it has a good and nowadays there's a lot of awareness in pet parents. They are already doing corrective surgeries for skin fold issues. Uh, Radicectomy is being done. So the success rate and the awareness, I would say, is marvelous as compared to last 15 years or last 20 years development in this field of ophthalmology.
Thanks everyone, all participants, the speaker of this webinar, Dr. Tripathi sir, Dr. panelist, Dr. Shalaka ma'am, and Dr. Shai sir for guiding us and sharing your knowledge. I thank everyone.
Thank you, Dr. Vedika.